We're live.
Okay, hi. As we lead into a COVID Christmas, and so many of us are separated from our families and still processing all the trauma from 2020, we wanted to really bring you guys some positive news and a bit of a dose of inspiration from some, and give you an opportunity, I suppose, to collaborate with some real frontline heroes of 2020. So I have with me Mushfiq and Bushra, and we're going to be chatting with them today. So I'm going to introduce you guys in a couple of minutes. I just might wait for a couple more people to join us. And so if you are live, if you're live online, it would be awesome if you just drop us a little message in the comments, let us know where you're tuning in from. So I am based in Melbourne, and Mushfiq and Bushra are in Bangladesh. And for those of you who don't know me, I am Johanna, and I am one of the co-founders of Just Peoples. So I'm based in Melbourne, and my COVID story has very much been about juggling preschoolers through most and work with through most of the year with pretty much most of the year's been a lockdown in Melbourne. So it's been a stressful year, but we've been safe, we've been well fed. We've really missed our family members overseas, so that's probably been the hardest thing for us. But I'm very conscious that there's been a lot of people facing completely different challenges all around the world. So we've got Cardinale tuning in from Italy. We've got Melbourne, we've got Christchurch, another one from Melbourne. Hi guys, welcome. Great to see you. Okay, so we have been sourcing incredible local heroes around the world for about 5 years so far through Just Peoples. And these are people who have got a track record of tackling poverty in their local communities, and we connect them with people who have the means and passion to support their work. So we have about 15 project leaders around the world, and today I want to introduce you to our favourite power couple from Bangladesh. So Bushra and Mushfiq are two of my favourite humans on the planet. They always have some crazy, incredible invention to solve poverty in Bangladesh. They're always out there with new ideas, solving social problems everywhere they go, which is super cool. Bushra is a microbiologist and Mushfiq is an electrical engineer. And they're the co-founders of WizKit, which is a social enterprise where they're working to impact the lives of 1 million Bangladeshis through research, innovation, and education. And something else that's super cool about Bushra and Mushfiq is when we're all celebrating Christmas on Friday, they are going to be getting married. So very, very special. We're very, very excited to tune into their wedding on Friday as well. So very cool news, guys. So yes, many of you have supported their innovations over the past 3 years, and Christy and I have had the pleasure of meeting Mushfiq and Bushra in the flesh last November. And since then, while many of us have been sort of overdosing on Netflix and adopting random new hobbies to get through the lockdown, Mushfiq and Bushra have been working round the clock and focusing their skills and innovations on how they can support the frontline COVID response in Bangladesh. So they've been designing and 3D printing PPE and ventilators. We've had so much overwhelming support from so many of you to back their work, which has been really cool. So we wanted to give you an opportunity just before Christmas to actually meet these guys and hear a bit about what life's been like for them and the awesome stuff that they've been able to achieve with your donations, with your support. So welcome, Mushfiq and Bushra. Thank you so much for joining us.
Thank you for having us.
Hi, Joe. Thank you so much for having us.
So first of all, it would be really great if you could share with us a little bit about the context of COVID in Bangladesh and how it's been for you both.
Absolutely. So I think like COVID has been extremely different to us in terms of the challenges that we face. Because usually we work in social innovation, so we work with poverty, we work with education. But when the pandemic hit, like it was a completely different sort of scene and change of scene for us. And for me personally, it has been quite rough journey from the beginning of the year, especially because like we didn't initially know what to do. Education institutions closed down, and then a lot of people in Bangladesh didn't really want to wear masks or didn't know why to wear masks, and people were gathering around, and so we had COVID contracting in Bangladesh really, really far, like fast from March.
Yes.
And like over that, what has happened is like we almost crossed a million mark. I think we crossed a million mark yesterday in Bangladesh in terms of COVID contractions. And over that,
Wow,
what
a
has been
million.
happening is a million, yeah.
Wow.
And most of these people are being admitted to hospitals, and we barely have like 50 or 70 ICU beds in the entire country, and we now have a million patients to treat, and we don't have any equipment whatsoever to do that. And that's why this has been very scary for frontliners and for people who have been treating these patients and these people from like the alleys or the hallways of the hospital without any proper equipment or any protections, right? And we have also seen like a lot of doctors have like died in the process as well, and that has been something that was very sad to see. um, and what has personally happened, like from my end, what I can say is, so around June or July, my grandfather also got like really sick. He contracted COVID, and he was at the hospital, and I had to spend like a month with him at the hospital, and I was there firsthand, looking at whatever was happening inside the hospitals. Very unfortunately, like my grandfather was extremely close to me. He passed away due to COVID. And just after that, because I was at the hospital, I also came back, and within like 14 or 10 days, I also contracted COVID myself. And I personally was also very sick for 20 or 30 days. And it was a slow sort of recovery process. But even when I was sick, we were still, putting out facials and other things that we were doing back then. Busha can talk a little bit about that. But basically, what we have been doing from the very beginning is trying to support as many people as we can to help them get back to work, to help them serve, and help the frontliners keep moving. And the personal journey has been quite difficult at certain points, and also has been quite rewarding in the places that we have been able to help. And that's of course because of you
Yeah.
guys.
Absolutely. I think, yeah, I'm so sad to hear about your grandfather, Ashok. I know how close you guys were. And I'm pleased that you're able to find, like, to be able to channel your energy into making sure that more people in Bangladesh don't get sick. So what you guys are doing is so important, and I know it means so much to you personally. I know Bushra had COVID as well. I just see that Christy, who's the co-founder of Just Peoples, has just mentioned in a comment that she's dialing from Tokyo. She was supposed to be on this call, but she's down with COVID too. So, it's real. It hasn't been huge in Australia and New Zealand, but it's really, really overwhelming in some countries. And it's surprising when you actually meet people that have had it, how much it can really knock you for six. So I'm really happy to see that you guys are still well and able to jump on the call with us. Bushra, it would be really awesome if you could, tell us a little bit more in a bit more detail about the work that that you guys have been doing.
Yeah, thank you. So I think the kind of work that we've been doing sort of shifted a little during March, because ever since lockdown began, sometime around late March here, um, we kind of had catapulted already into doing a COVID response, because as you already know that so many people were getting infected so rapidly, so quickly. So we really were sort of brainstorming and thinking all the stuff that we could be doing at that time to help everyone around us, because everyone needed some sort of COVID response at that point, including the doctors, nurses, and all the other healthcare workers. So initially, what we were doing through WizKit was that we were 3D printing face shields, and so far we've distributed almost 4,000 face shields to the doctors and
Wow,
nurses.
awesome.
Yeah.
And so how many
So,
3D printers did you guys have on the go at once? Like,
we had around 4 at once going, and that's all thanks to you guys again. But yeah,
that's cool. And did you
we
have them
were
in your
able.
house? Because you guys were in lockdown, right? So you're doing
Yeah.
it.
Oh, so we had, because offices and everything were closed, so we literally had to do everything from our living rooms and from our rooms. So that was a different adventure all by itself. But we did not. We were really fortunate in a sense that we really did not have to stop our work. We could immediately respond whenever we were asked to or asked
Yeah.
for. We got the chance to collaborate with different organizations and do COVID responses here locally in Bangladesh, and uh, just that was it's been like an absolute whirlwind since March because of the quick number of infection that's been spreading everywhere, like in Dhaka, and because there's so many people and there's so little space everywhere. But I think otherwise, what we were doing afterwards when the patient number of patients started to increase was that we started distributing disinfection chambers. That was something we were doing around April and June, April through June, July, August. So we also did that for bigger institutions such as hospitals where a lot of patients were coming in and going out, daily, and other industries such as garment industries.
Yeah.
Because I think something here in Bangladesh that's very specific is that even under lockdown, I think most of us, 90% of the people living here don't have the luxury to stay under lockdown or stay in quarantine. We
Yes.
have to go to work. We have to sort of get out. So um, instead of finding a cure, we have to take as much precautions as we can and try and prevent it as much as we can because there's literally so little space between people because like it's just a dense, crowded
Yes.
city.
Did you guys have
Yeah.
like I think it's like 150 million people, right?
It's
Yeah,
180 right now, but yeah,
180.
officially,
yeah, it's 180
yeah.
million now. Yep.
Yeah. So, and
Wow.
in Dhaka, yeah, in Dhaka, it's around 2 crore, which is 20 million people.
Yes.
So, yeah, so whenever you're out in the streets, there's always someone who's sneezing over your shoulders or who's just brushing past your shoulders. There's literally no space. So, other than
Yes.
wearing your masks and carrying sanitizers, we were constantly, brainstorming about ideas or, taking initiatives through which we could be um, securing and sterilizing the people who were around us, in office spaces and in hospitals as well. So
Yeah.
we've been quite successful in doing that and to the best of our abilities, and we're very happy about that. And
Yes.
when we also saw, I think sometime around August, that Stanford was developing the PAPRs by using snorkel masks, we were really intrigued and interested in the idea as well because if you can repurpose something as simple as a snorkel mask into providing you a complete protection and replacing um, a face mask and goggles and face shields all together, so we
Yes.
thought that was very important and something that wasn't just a single use thing that we would just use and throw away. um,
Absolutely.
what we were thinking at that point was, if we could help out the doctors and nurses with something like that. Oh, also
Yes.
because people here have little to absolutely no heed for instructions. So if you tell them to use, just one single-use mask one time, they'll probably wash it and keep using it for like a month, and they will have no idea that it's not working anymore. And even
Yes.
sometimes, unfortunately, the doctors as well. Sometimes just out of ignorance, but sometimes also out of a lack of supply of PPE itself. So we finished sort of doing the PPE, making or repurposing, however you want to say it, after we saw that Stanford was doing that model, and we got really excited because we were doing a motorized one and non-motorized one as well. And because it
Yes.
was providing a complete filtration of the air that the doctors and nurses were breathing. So we were really happy with that. And
Yes.
ever since we've
You
been.
you actually have one with you, don't you? Can you show? Yes,
Yeah.
you've got it there.
I,
Very,
I'll
very
break it
cool.
down for you guys when I'm like showing you the whole thing.
Yeah. So how does it actually work?
So basically, this is a regular snorkel mask. You guys know this, have seen this before. This. So this is a regular snorkel mask, and then we 3D printed this part. This is an this is an adapter, and then the top one is a 3M filter, right?
Yeah.
This top pink thing is a filter that sits on this adapter. This adapter is 3D printed, and what we can do is, I'll just show you guys. You just attach it like this, and ta-da! You have snorkel-based PAPR that filters your air.
Wow, that's awesome. Because when you guys like first told us about these, you were telling us about, you know, so many doctors getting sick, and so some were actually refusing to come to work. Is that right? Because they didn't have proper protection. So I just think, yeah, I'm blown away by like the huge impact that you guys are making with these. It's yeah, to get more doctors to come to work when there's, you know, 1 million people with coronavirus is absolutely essential. So yes, that's absolutely awesome. And what kind of demand are you guys seeing for them?
Yeah, so like basically you just saw me wearing this. So one thing that you can see is like this is also replacing, like the doctors need to wear goggles as well for eye protection. They need a face shield, and then they need masks. So this is sort of replacing all of those three disposables with one non-disposable material. And that saves doctors a lot of money. Plus it, because PPE is like rare right now because I'm super expensive. So this is very cost saving for them, and they're looking for this like crazy. Like we have 100 calls every day with doctors asking us, can we have more of these? And we're like, we don't have that many, but we are going to ship out as many as we can. And that's what we have been doing. We have been fundraising a little bit and just trying to send out as many as we can out.
Yes, absolutely. So you've got the 3D printers on the go, like you're managing the fundraiser. You're like, oh, it all. Okay, well, where we can help is we want to do some fundraising for you. So I did promise that that you guys that are watching today would have an opportunity to collaborate with Bushra and Mushfiq to get more of these amazing life-saving devices out there. So if you are looking for a unique Christmas gift this year, and you'd like to, you know, let's be honest, it's a bit of a COVID Christmas this year, so it's quite timely and appropriate. We've got a link in the comments there to buy one of these masks. So basically what that means is that your donation will go straight to Bushra and Mushfiq 100%, and they'll use it to make one of the masks. So there's a comment in there from Patrick. Hi, Patrick. How much does it cost to make one of the masks? So it's about 90 Australian dollars to make one of the masks, and that is a reusable. What does it PAPR stand for again?
PAPR is powered air purifying respirator.
Powered air purifying respirator. This is why we've got the experts on the job. Excellent. So that's what you were showing us in the parts with the 3D printing that actually purifies the air. So it's specifically for doctors and people that are around COVID all the time. Is that right?
Yeah.
Perfect. Okay, so we've just got the link in the comments there. So if you're keen to buy a mask to support these guys, you can pop to that link that's in the comments. We've got a range of different gifts for Christmas in there, which are all supporting communities around the world. And so what will happen when you make the donation is the money will go straight to Bushra and Mushfiq, and you'll also get, if you put in the details of email addresses, you can actually send it to a friend to say, hey, this is what I got you for Christmas. So it's really good for those friends who kind of have everything, or also those friends who have got big hearts as well, that would like to receive something that's, you know, a zero waste gift, but also making a huge impact in the world. So please check out those gifts. Thank you so much, Bushra and Mushfiq, for joining us today. It's been really special, especially 2 days out for your wedding. Like, I know you guys have been running around like crazy. So thank you so much for making the time to share with our community the awesome work that you've been doing. And yeah, I hope you guys get to you know, at least enjoy Friday before you've got to get back to work. But
Thank
yes,
you.
have a
Thank you.
wonderful wedding. Thank you.
Thank you.
Thank you so much, Joel.
And a huge thank you to everyone who's joined us live. And if you're watching us on the replay, it's really lovely to have you here. And yes, we look forward to seeing you guys in the new year and hearing what new adventures you're up to.
Thanks. Thanks so much, Joe.